If you can imagine, I woke up and dropped Alex off at his mom's house to go to school at 7 in the morning. He gave me a hug, says, "Love you, Daddy, pick me up after school." And at 11 o'clock, I'm in the hospital room, and he's on a ventilator, and he's basically gone.
Something that we are all passionate about at Harborview is the opportunity to really convert that moment of tragedy and sorrow into hope. And that's really what organ donation is about.
It's who we are. It is what we need to do. Organ donation is very much a part of Sacred Heart Medical Center and the mission that we have.
At UW-Medicine, it's a privilege to be a part of the organ donation and transplantation process. One of the most educating experiences I've had was working with Life Center Northwest as we were evaluating opportunities to look across the state and how do we increase donors. With the state of Washington having one of the highest donor registry rates in the country, we need to work with our community hospitals to help convert that high registry rate into more organs available for our patients on our waiting lists. Partnering with Life Center Northwest advances our Patients Are First initiative by reducing the wait times our patients experience.
Harborview has increased our donation this past year by 18%. This is because we have empowered senior leaders. We share the letters about successful donation at our board meetings. It is the voice of our patients. We share those letters with the staff, and I can't begin to tell you how successful that's been. We have the power to set this as an institutional priority, to provide our staff with the resources necessary to be successful, to provide them the education, the one-on-one coaching, the milieu to be successful. We understand that this takes an incredible amount of integration, coordination, and we've developed phenomenal relationships and systems with our OPO. We office them, we house them, we welcome them into our family. It's that important.
We've got a very active team, and I would encourage leaders to really become involved in understanding what that team is all about. We adopted kind of some alternative ways to get people to think about organ donation and involved our chaplains in that process. We've gotten physician champions involved, making certain that the physicians really understand how they can either help with that process or really just allow for the team members to begin to help with that process. And that team isn't just the internal team, it's also the Life Center Northwest team and or the tissue donation team that they're participating with. We have an organ donation flag that when there's either a recipient that's receiving an organ or an organ is being donated, we fly a flag, and it's very visible outside our cafeteria as well as on our flag pole.
As nurses, as critical care nurses, we are able to provide a lot of support for both the families and the OPO during that time. It's a big job and it can't be done independently.
It's something that you can participate in which will be meaningful to somebody else and bring life to another family, to another individual somewhere.
We changed the lives of so many people. They were able to give back and really increase the opportunity for life fulfillment for the next person. That in itself is what drives our passion.
When you hear the gift of life that people are giving to each other, and you see the gratitude that the recipients have and the gratitude that the donors' families have, the stories are just so heartfelt and so touching that you realize that when we talk about this being organ donation, being the gift of life, that it really is the gift of life.
Right about that first anniversary, I was a complete wreck. And when we went to meet the recipients, I remember walking out telling my wife, Tammy, I said, I feel different. And it was just like you flipped a switch. The thing I like to say is I went from missing him terribly to missing him wonderfully.